The deadline to enroll under the Affordable Health Care Act, also known as Obamacare, is fast approaching. The March 31st deadline is just days away now, but the White House has announced an extension, but only for those with special circumstances. Ebru's Derricke Dennis is live in New Jersey to explain it all to us. Derricke.
Logan, it's doctor's offices like this one here, local doctor's offices that will have to carry out Obamacare coverage even after the deadline and even after extensions. Yes, we've learned that the White House will give people extensions, but only if they qualify. 6 days and counting until the official deadline to sign up for the Affordable Care Act known as Obamacare. The website, healthcare.org, continues to log a record number of signups, and that means doctors' offices across the U.S. will be busier than ever.
My left eye got blind, and I started to have a huge headache, and my left arm and left leg started to get paralyzed.
Mustafa Derman suffered an aneurysm years ago that rendered his left leg and his entire left side numb, and ever since Obamacare became law, his medical situation grew complicated.
Well, my Medicaid was cut, so simply I'm on Medicare. I used to receive Medicaid, and they cut, I don't know why, and we are trying to find out if I can get it back.
He's exactly the kind of patient that led the Obama administration to announce an extension to the sign-up deadline for Obamacare. Patients with special circumstances, such as a complex medical condition, will now get more time to enroll on a case-by-case basis. The extension also makes up for any technical glitches with the Obamacare website early on.
This is an ideal opportunity for people to go on the internet and register in some form of insurance.
Dr. J. Rajasekaran says some 30% of his patients are uninsured. Obamacare will fix that, he says, but people have to enroll.
Because the premiums are less and the coverage is somewhat more expanded.
And that means lower medical bills and less worry for Mustafa Duran.
That's what we heard, and honestly, that's what I'm hoping for.
He and millions of others signing up for Obamacare either by the deadline or with the new case-by-case extension. It's not clear, though, what that extension will actually entail. White House officials have not said how long the extension will be and who exactly will qualify within those parameters that were mentioned. So it really is going by the honor system. People who enroll on the website are asked to check a blue box on the healthcare.gov website claiming they need an extension, and then they'll have to wait for further instructions from there. Again, how long that extension will last, it's not yet clear. Logan, back to you.
Now, Derricke, Mustafa, whom you just talked to, who had that brain aneurysm that left him partially paralyzed, is an example of a person who has been hurt by Obamacare and will possibly now be helped by Obamacare, correct?
Right, exactly. He said he lost his coverage as soon as they implemented the Affordable Care Act and had to switch over to Medicare. So, yes, he was a victim of Obamacare in his words, but also he's very optimistic that once it's all ironed out, he'll have better coverage and hopefully at cheaper rates. So he was complaining initially, but he's optimistic as well that his coverage will get better.
Derricke, I know you've been covering the story extensively. Tell me what the experience is like for most users nowadays who try to access healthcare.gov.
Yeah, I talked to a lot of experts about this. They say the website has dramatically improved. The glitches that we saw early on, especially in the first few weeks of the rollout, have largely been fixed. A lot of them, the experts I talked to, are giving it about an 80% user-friendly level. That means that 80% of people who try to enroll on the website are able to get through, and those who aren't are supplemented by being able to call online or go to healthcare.gov centers, clinics in their local town, in their communities, where they can get hands-on, face-to-face help. So there is a lot of people who are getting that access in different ways and able to sign up for Obamacare in different ways.
All right, Derricke Dennis reporting live tonight from the Garden State. Thank you so much for that report.